Hello and welcome to our series here at the Minneapolis Foundation on the state of Minnesota nonprofits. This series dates back to January when we had the head of the Minnesota Council of Nonprofits in to talk about the challenges facing the whole nonprofit sector. And that chat, by the way, is on our YouTube page, the Minneapolis Foundation YouTube page. This is an extension of that conversation as part of the work we do to bring fund holders closer to the work happening on the ground. So by highlighting the work of specific nonprofits, we hope that fund holders will gain a better understanding of how rapid changes are affecting organizations so that they can be better equipped to make their giving more impactful in this moment. My name is Tom Weber, and I'm pleased to be joined by Ann Cazaban, who is the Executive Director of Southside Community Health Services, which is a federally qualified health center in Minneapolis that offers a wide range of services and does not turn anyone away for inability to pay. So Ann, thank you for being here, and just start off by saying how your organization is doing right now.
Great. Well, thanks for having me, Tom. I appreciate the opportunity. I always love to talk about Southside. So any chance I get, I'm grateful for the opportunity. I think right now what we're really focused on is working on our mission, keeping that as our guiding light. So it's really improving the health of our patients and communities by delivering exceptional care, removing barriers, and promoting healthy lifestyles. As a federally qualified health center, or health center for short, we've got a long history of understanding the needs of our patients and our community and responding to those needs through primary care and preventive services, and then meeting our patients where they are. So I think it's important to understand that the health center's role in the overall health, care landscape. Southside, we've been around since 1971. We were actually founded by a collaboration between Abbott Northwestern Hospital, Southside Ministries, and some Vista volunteers to provide affordable access to healthcare on East Lake Street in South Minneapolis. So as a health center, our role in the community is really that of a safety net. We're there to catch all people, as you said earlier, to take care of everyone regardless of their ability to pay, and really give people that affordable access to healthcare, as well as many of the wraparound services that help people achieve their best health. So at Southside, we provide primary medical, dental, vision, and then we have integrated behavioral health services that we provide. And so we are really reliant on public and private funding to support the work we do. In 2024, 39% of our patients were uninsured, mostly because they weren't eligible for public programs. 85% of our patients are BIPOC, and the majority of them are at or below the federal poverty guidelines. And so, we receive nearly $3 million of federal funding every year to support and offset the costs of seeing those uninsured patients, which is really important to where we are. And right now we're wondering if that's going to continue. So that's a bit of an uncertainty that's pretty scary. I think when we talk about the overall health and well-being of our community and our role as Southside in that, we know that access to healthcare is only about 20% of people's overall well-being. Genetics plays a role, lifestyle certainly plays a role, but I think most importantly, the people's social determinants or health-related social needs are what truly impacts people's ability to achieve their best health. So at Southside, what we do differently that's maybe different from an Alina clinic or a Park Nicollet clinic is that we provide many additional services that our patients need. We call them wraparound services. So for example, we have a chronic condition management program that provides one-on-one nutritional support. We do diabetes self-education. We provide cooking classes. We have 4 full-time staff on board to help with patient navigation, so helping people apply for insurance. They've been very busy this year with the redetermination and then with the undocumented program at Minnesota Care. And then we have care coordinators that just help people, support our team-based approach to providing healthcare. So when you ask, how are we doing today? We have an access problem at Southside. There's so much need in our community for affordable access to care, and we're not able to meet it. We've just come out of a global, several years of a global pandemic, where I think many of my healthcare staff, certainly we've seen this in many other healthcare organizations, are struggling with burnout. And when I think just about the vicarious trauma that my staff and others in healthcare have experienced with, COVID, the civil unrest after George Floyd's murder, that happened just 6 blocks away from Southside's clinics in 2020. I'm just really proud of our resilient and committed staff. I think we've really risen to the occasion in these really uncertain and scary times. Many of our staff and patients are immigrants. As a health center, we hire from the communities that we serve. Our board of directors reflects the community that we serve as well. One of the rules of a federally qualified health center is that 51% of our board has to be patients. And so that's, I think our board and our staff are really keenly aware of the challenges that our community and our patients are facing. And again, it's just a very scary and uncertain time to be in healthcare.
Yeah.
But as I mentioned, I think we're focused on what we can and do what we can for our patients, as we've always done.
So just to clarify, you mentioned the reliance on public money, state money, federal money, probably some city and county money in there too. Has there been any cut or contract axed to date, or is it all just a waiting game at this point for you?
So our federal award is a waiting game. We don't really know what's happening. Normally we're funded for the full year. This year we've just been funded through June. And so we're still waiting to get the remainder of the year in our federal clearinghouse account. We're assuming it's going to pass, but right now there isn't a federal budget passed. So they're on continuing resolution. So it's always an uncertainty. And I think especially now it's particularly uncertain. I think that the advantage we have at Southside is being a federally qualified health center. We're one of 1,500 health centers across the U.S. We're the largest primary care network, actually, in the United States. We serve about 33 million people collectively. And I think 98% of the zip codes are covered by a health center in one way or another. So in many rural communities, for example, a health center is the only access to primary care. And oftentimes those providers are also working in the critical access hospitals, things like that. So the good news is that we've long had bipartisan support that we've enjoyed, and we're even included in the current administration's Making America Healthy Again platform because we focus on primary and preventive care services. But, we receive $2.8 million a year at Southside from our federal agency. And so, without that, we use that to help offset the cost of our uninsured patients, for example. We get an additional $700,000 from the federal government to expand mental health and substance disorder services. We receive money to do some early childhood development screenings to make sure that we can intervene earlier with children, so we're able to get them access to services to help them also do better in life. And then, our foundation grants, the Minnesota Department of Health, the city, and others helps us pay for all those other services that I mentioned earlier, chronic condition management, nutrition counseling, the MNsure navigation. That's not something that patients pay for. It's a free service. And so, having support through the state for that makes it, helps us be able to help our patients get the coverage that they need. But, that being said, our federal funding has stayed stable since 2019, even though we all know that costs have greatly increased. Staffing, especially in healthcare, it's a very competitive market to find staffing. And I think what's different now, Medicaid is really at risk. Over 50% of our patients come to Southside covered by Medicaid. There are lots of clinics that don't accept Medicaid, in particular for dental services. So if you have Medicaid, there are very few places where you can actually take that insurance and get dental care. And we just learned this morning that the Minnesota Care Immigration Inclusion Act will no longer include adults. So at the end of 2025, undocumented adults will no longer have access to Minnesota care in Minnesota. Children will remain eligible, uninsured, undocumented children. Southside last year, I mentioned 39% of our patients were uninsured. 900 of them were children. So there's a lot of children in our state who are also uninsured. And so it's really important that we're providing access. So Southside, along with there are 16 other health centers like Southside in the state of Minnesota. And so we're working with the state to try to figure out, there's going to be a huge influx of uninsured people coming next year. So we need to make sure that we're providing affordable access to those people. There's talk that at the national level, they're saying the cuts to Medicaid and changes to the program will probably put 16 million or up to 22 million people, off the program, which will have huge impacts for the state of Minnesota, for our community too at Southside. And just creating more barriers to care with with the work requirements and, we're trying to be more efficient, and we're adding work requirements and more paperwork and eligibility every 6 months and things like that. I mean, that's going to have a huge impact on people. And really what it does at the end of it, it discourages people from seeking care until it's emergency, and then they're going to the emergency department. And the truth of the matter is we still pay for those services, as taxpayers. So it doesn't, these people don't go away. It's not like we can just write off those charges, and we're not doing, right by our, the folks in our community. So, that's our biggest challenge.
Yeah, you talked about your board and the unique makeup of your board, majority of people who are patients there. How has governance played into your life these last few months? I regardless of whether it's a unique board or kind of a more traditional board for a nonprofit, I think people come to those positions with a wide range of experience or real understanding of what is expected of them on a board. Have you had to how has your work working with the board changed in these last few months with all of this that's going on?
Well, I think the board is, they're as I mentioned earlier, they're keenly aware of the experience that our patients have, because they are patients of our clinic. So it's very helpful. I don't need to explain what's happening in the community because they know. I think my board is very concerned about just the uncertainty. They feel the fiduciary responsibility to the organization, and we're not the opera. We're not asking board members to write checks or anything like that. So they're really just volunteers. We don't use them as fundraising. That's my job. But they're really concerned. They're concerned about their families, their friends, their neighbors, our patients, my staff. At Southside. And they feel a bit helpless in this scary and uncertain time. And they read things in the press, and they come to board meetings, and we have to debrief. They hear that the federal funding, in January, for example, when the clearinghouse was out of order, shall we say, for several days, lots of organizations were not able to make payroll. That's it's a pretty scary place to be in. So they're just, they're very concerned. They joined the board to help us grow as an organization and do what we can to meet the needs in the community. And, they're kind of forced into this, these executive orders that people are not really sure what exactly they mean and what it means for them as board members. And so we do a lot of, like I said, a lot of debriefing and talking through things and explaining things and trying to assuage their fears, but I get it.
Yeah. Well, what are your final thoughts? What would be your final thoughts for folks here watching, especially about the work you may be doing coming months?
Yeah, well, I think the big news for Southside is over the next several months, we're putting the finishing touches on our new clinic on East Lake Street. So it's just east of the Midtown Global Market. That's a space that was formerly a former Family Dollar store that burned down during the civil unrest in 2020. So we're calling this new space One Southside. It's going to be a one-stop shop. It's just over a 30,000 square foot building where we'll have our services under one roof. Currently, we're operating out of two separate clinics in South Minneapolis. We've got over 1,000 people on our dental waiting list, for example. So we'll be able to double the access that we have for dental care, going from 14 to 29 chairs. We'll be adding additional services like mammography and x-ray and ultrasound in-house, because we know the more things that we can do in-house for our patients, the better off they are. If we give a referral and they go over here, they don't always go. So we're just looking also forward to partnering with other organizations on East Lake Street, working with other social service organizations, Greater Minneapolis Council of Churches being one, work smarter together to meet the needs of the community. And we say that we like to build fences along the cliff instead of putting an ambulance at the bottom, right? So, whatever we can do to invest in primary care to keep our patients and our communities healthier, that's really what we're focusing on. And we're looking to, I think, the One Southside project will provide, over 50,000 patient visits a year, which is a huge increase in access. We'll be just, close to the Alina campus, partnering closely with Alina, but providing that high quality integrated care, and help be a part of sort of the East Lake Street revitalization, and really getting us closer to our vision that every member in our community has the opportunity to live a happy and productive life, based on this foundation of good health.
Ann Cazaban from Southside Community Health Service, thanks so much for sharing with us here today. We hope that
Of course.
by joining us, we invite our fund holders here to connect with their philanthropic advisors. If you have further questions about this organization or the area of work it performs, we're excited to work with you to find a plan for giving that works best for you. So thank you for joining us.
Great. Thank you so much for your time, Tom. Appreciate it.